Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on May 1st, 2025. As a heads up, on May 13th, we have a live taping of a health policy. The guest will be Andrew Ryan from Brown University to discuss state affordability's standards impact on hospital prices and insurance premiums. The event is free and open for all to attend. Check that out in the show notes. And for insiders, on May 29th, we are hosting an event on the FDA's first 100 days under the second Trump administration. This will be moderated by Rachel Sachs, and the panel will include Richard Hughes IV and Artie Rye. With all the layoffs and restructuring occurring at HHS, I thought it might be interesting to hone in on an example on how those decisions may or may not impact an agency. Also, I kind of wanted to Trojan horse the idea that data and research has an influence on our lives in some ways. So if you follow A to B to C, and I hope you did, but don't think about it too hard, we're here today to talk about the behavioral risk factor surveillance system at CDC and its influence on behavioral health. Today, I'm joined by Health Affairs Akilah Wise. Akilah has worked at the CDC, so I'm looking forward to getting a behind-the-scenes perspective on this. Akilah, welcome to the program.
Hi, Jeff. Thanks so much. So good to be here.
Yeah, so we were mentioned off mic, and people love to hear about this. It's getting hot these days, huh?
Yeah, it's super hot. I'm in Georgia, and I think it's just going to get worse from here on out.
Yeah, the weather will get worse from here on out. In Virginia, we just like to say the humidity's coming, and it never stops. Moving forward to the topic at hand. So among the layoffs at HHS, many were cut from the CDC. According to MedPage Today, the agency's Division of Population Health was eliminated, with one exception. The behavioral risk factor surveillance system was spared. So, Akilah, what is this system and what's tracked? What's the cadence of this? Give us a primer on this.
Sure. So just to take a step back and define what behavioral health is, according to the CDC, behavioral health refers to the state of mental, emotional, social well-being, or behaviors and actions that affect wellness. It also refers to support systems that promote well-being and prevent mental distress, and also that provide access to treatment and services for such mental health conditions. So it's really important to understand that, and improving behavioral outcomes means addressing factors at multiple levels, including social determinants of health and supportive environments. And so this leads really nicely into the actual survey. The behavioral risk factor surveillance system, or BRFSS, or even BRFS, some people refer it to, is a state-based national system of telephone surveys and in the U.S. And it collects data about health-related risk behaviors of U.S. adults, so folks who are 18 and up. And the sort of data it collects really gets at this behavioral health aspect. So cigarette smoking, fruit and vegetable consumption, chronic health conditions like diabetes, arthritis, depressive disorder, and even the use of preventative services like cancer screenings and routine doctor and dentist checkups. So the BRFSS is a collaborative effort between the CDC and each state's health department, and it's the nation's leading ongoing health-related survey. It was established in 1984 when it started with 15 states, and currently it completes about 400,000 interviews each year in all 50 states and the District of Columbia, as well as the Virgin Islands, Puerto Rico, and Guam.
Yeah, so you used to work at the CDC. We were talking offline that you didn't work on this survey specifically, but I kind of wanted to get a sense of how are surveys like this at the CDC used to help create public health programs or policies?
Yeah, so surveys are really powerful tools. BRFSS is the main one that's very powerful. I worked in two divisions at the CDC previously. One was within the Division of Population Health, where the BRFSS was housed before being moved. Within that division, I worked with the Healthy Aging branch on arthritis. And the other division I worked was the Division of HIV Prevention, and they conducted their own surveys around HIV. So surveys help us create public health programs and policies by providing the data on which to base those programs, policies, and recommendations. So federal, state, and local health officials regularly use BRFSS. And without these data, they would be playing somewhat of a guessing game about health issues and how they affect people. So, for example, we know that 1 in 4 U.S. adults have arthritis. thanks to the BRFSS. And we can also identify which groups of people are most at risk of arthritis. And so that sort of information helps public health officials design programs and recommendations.
Did you say 1 in 4 adults?
Yes, 1 in 4
Okay.
adults.
So you are not alone. Anyone that's listening that's
No.
rapidly aging and thinking.
Yeah, and it affects non-elderly adults as well. Of course, there's a higher prevalence with folks who are older than 65, and arthritis is just what happens, as we age and we use our bodies. So eventually, each of us will have arthritis at some point.
Yeah, I like the humidity it comes for us all is
Yeah.
what I'm hearing. Yeah. Okay, so thanks for that. Let's draw out another example. On our Health Policy feed, Rob Lott next week is going to be talking to Eric Topol, who wrote a new book on super aging. I can't really talk about that interview too much because it is under embargo until next week. So check that episode out. But there is some work in the book on the intersection of exercise and health. And I have always thought that was an interesting connection. It's always been apparent, whether overtly or not, but more research is drawing out exactly how exercise is linked to all kinds of positive risk reductions in health. And this is also a focus on the CDC's BRFSS survey. So, what's some of the latest evidence on the connection of exercise and health according to this survey?
In general, I'll speak in general. So we know that the benefits of physical activity is well documented. It reduces chronic conditions like blood pressure and diabetes, some of the immediate effects like good sleep and reduced anxiety. We know that. The CDC says adults need at least 150 minutes of moderate intensity physical activity per week, including muscle strengthening exercises. And that shakes out to be about 30 minutes a day for 5 days a week. And it's recommended for people who are over 65 years to do additional activities that improve balance, like standing on one foot. So there's a new study by researchers at Hopkins that found engaging in as little as 35 minutes of moderate to vigorous physical activity per week, compared to no minutes of activity per week, was associated with 41% lower risk in developing dementia among adults. And this was in the United Kingdom. So they didn't use BRFSS, that's US specific, but they did use data from the UK Biobank, which is actually a little more comprehensive than our BRFSS because it includes genetic and health record data. But again, the idea is that these surveys really help us understand what's going on population wise. And in this case, they use this sort of data to find that physical activity actually helps with dementia. So there's another study, though, that used a large US data set called NHANES, and they found physical activity is linked to longer telomeres. Telomeres are nucleotide caps on our chromosomes. The older we get, the shorter our telomeres become. So telomere length is a biomarker of aging, actually. So this study found that high activity adults, so that vigorous activity, had significantly longer telomeres than sedentary adults. So this translated into an almost 9-year biologic advantage. And they actually had a 7-year advantage over adults who were moderately active. So this data, as well as other emerging evidence, is showing that physical activity has this anti-aging effect for adults.
Yeah, so I think with what you're saying is we've always known that there's a general link to physical activity and health. A lot of people have been exercising for a long time for a lot of different reasons, and so a lot of this research is drawing out exactly how it's impacting us physiologically, and also you can kind of run some parallels of I think generally people know what healthy foods are, fruits and vegetables and that kind of thing. So, but then there's that what does it look like in practice? What are people actually doing from a behavioral health perspective? And that's where I think the BRFSS can come into play. So one of the things it tracks is physical inactivity. So taking together, what do we know about the US? How are people moving around?
So I'll focus on physical inactivity because there's a lot of data there. Yeah, so the CDC collects data on a number of factors, as I mentioned, including adult physical inactivity. So this is based on a question that asks whether someone has done any physical activity outside of work. And people who answer no are classified as inactive. Based on the latest CDC analysis of these data, which includes years 2017 to 2020, the overall prevalence is 25.3%. So that means 1 in 4 adults are physically inactive. They're not doing physical activity outside of work, as they report to the survey.
Are
We
these the
can
same people with arthritis?
Probably,
Okay.
or at least some overlap. And even with that, we can combine data to see if there's a link between physical activity and arthritis. So you actually introduced, one of the ways people use these data is to look at various factors, and you can look at that and see the relationship or any trends. We can look at these data by states and territory as well. And that's where states, find it really useful, because then you can design programs for your constituents. So we know from this data that states in the South had the highest prevalence of inactivity at 27.5%, and the West had the lowest prevalence at 21%. So you can see how these data can really be helpful for state officials, local officials, and public health. We can look at individual states and see that there are 7 states that have physical inactivity levels of 30% or more. So that's 1 in 3 adults, and that's West Virginia, Oklahoma, Louisiana, Alabama, Kentucky, Arkansas, and Mississippi. So, these data can become really powerful tools. And what we know is that increasing physical activity is a comprehensive effort from many groups. It's not just telling someone, get up and exercise. It includes individuals, communities, our public health agencies. And so, for example, state and local officials can encourage and implement physical activity programs, and even design, communities that are safe and active friendly. So this is just one of the many ways these sorts of data really help with public health action.
So, thanks for drawing all of that out. This dovetails in some ways with the establishment of the Make America Healthy Again Commission, which seeks to, quote, aggressively combat the critical health challenges facing our citizens, including the rising rates of mental health disorders, diabetes, and other chronic diseases, unquote. What are the avenues that they state for that they're trying to accomplish that?
Yeah, so going strictly by the materials that the administration has released so far, one of the avenues that they're looking to meet these challenges of mental health disorders, diabetes, other chronic disease. For one, they name fresh thinking on nutrition and physical activity, healthy lifestyles, and other things that affect health. They talk about restoring integrity to the scientific process by protecting expert recommendations from, quote, inappropriate influence, and increasing transparency regarding existing data, end quote. They also propose to address health and healthcare by empowering Americans through transparency and open source data, and avoiding or eliminating conflicts of interest. They also propose to prioritize gold standard research on the root causes of why Americans are getting sick, as well as having agencies ensure the availability of expanded treatment options and the flexibility for health insurance coverage to provide benefits that support beneficial lifestyle changes and disease promotion. And the president also aims to create a commission that's chaired by the Secretary of Health and Human Services, assistant to the president for domestic policy, as well as the Secretary of Agriculture, Housing and Urban Development, Secretary of Education, and other cabinets. So, yeah, that's what they propose to do to address these health issues.
And you can somewhat see the line between sparing the CDC survey that we talked about on behavioral health and how that could be related to some of these. But it'll be interesting to see how those develop over time. Anything else that we haven't touched on that you might want to?
Yeah, the one thing I just want to say is that the BRFSS is very impactful. It's not only looking at these more static, chronic health disease and preventative issues, it's been quite flexible in emergency public health responses. So it's a powerful tool for establishing health objectives, programs, recommendations, and it's very useful in public health.
Okay, well, Akilah, thank you for joining us today on Health Affairs This Week. It's great to learn about that survey and how much of an impact it can make and how much it can influence state-based policies and other things like that, or how wide-reaching some data sources can be. So thank you for explaining all that for us. And to you, the listener, if you enjoyed this episode, please send it to the ultramarathon runner in your life, and we will see you next week. Thanks.
Thanks.